When your doctor takes your blood pressure and they read it back to you, do you even know what those numbers mean, or do you even remember them? And do you know the implications for your health? Dr. Payal Kohli, our resident cardiologist, our health expert, is here, and these are huge numbers to you.
They're huge, Kim, and it's funny, I called my mom last night and I said, your daughter's a cardiologist. Do you know your blood pressure? So she says, 105/65. I said, okay, now do you know what it means? I'm out. So do you guys know what those numbers mean, top, bottom?
It has to do with the pressure of your blood, right? Isn't that the...
Yeah. Okay, good guess, good test taker here. So let's talk about it. Top number is the number when the heart squeezes inside the arteries, which every organ is feeling. Bottom number is when the heart relaxes. But a hidden number, the third number, is the difference between the top and the bottom number. That's called the pulse pressure. So top systolic, bottom diastolic, difference pulse pressure. And all of those numbers predict cardiovascular risk. And in fact, that pulse pressure, the difference, even tells us how well our brain is aging.
Oh.
Yeah.
Now I'm kind of more interested.
I know, me
too. And I do know that we should care about what range those two numbers are in.
Yes, so let's talk about them. So the top number, we definitely want it to be less than 120. That's your systolic blood
Less
pressure.
than?
Less than.
Because forever, I know, wasn't it 120/80 was the number that used to be like the go-to number?
That's right, less than 120, less than 80. So the top should be less than 120. The bottom should be less than 80. Now, as we get older, we know that both the top and the bottom tend to have a tendency to go up, but sometimes we can also see that pulse pressure widening. So the pulse pressure, which is the difference between the top and the bottom, should be a range of 40 to 60. And the blood pressure is very much a Goldilocks phenomena. You don't want it too high, but you also don't want it too low, because the bottom number, the diastolic blood pressure, is actually the pressure inside the organs when they're getting blood. So for example, when your heart is receiving blood, that's the pressure. So if it's too low, then the organs aren't going to get perfused. They're not going to get the blood that they want. But if it's too high, it's starting to cause damage to the blood vessels and causing risk of plaque deposits and atherosclerosis.
You have me looking up my last reading.
Okay,
I
good.
know.
I
know
like
it's
this.
in there.
And
The
I
hard
want you
part is that low number, because sometimes some people run low, so to speak.
Yeah. So let's talk about that as well. As we get older, the difference between the top and the bottom tends to widen. That's called a widening pulse pressure. That's not a good sign. If the bottom number is going down as you get older, it actually means the arteries are getting stiffer. So the way that I want you to think about this is if you have, let's say you're blowing up a balloon. If it's a really elastic balloon, it doesn't take a lot of pressure to blow it up, right?
No.
But if it's a lead pipe balloon, you got to push really hard to blow it. So that's what that bottom number represents. It's the stiffness if it starts to go down or that pulse pressure starts to widen. Now, a new study just came out in the journal Neurology that says, me as a cardiologist, I'm always thinking about cardiovascular health, but the pulse pressure, the difference, maybe one of the best predictors we have of your brain health, cognitive decline, your risk of having a stroke, and even your risk of dying from dementia. So, you know, one of the things we fear the most as we age, having a stroke, having dementia. And this number could predict that, which means we could modify it and change that risk.
Ooh, I love that. So how do we modify? What do we need to do to make the change?
Okay, so first you know the numbers. Hopefully you got yours,
I got,
right?
I ranged between 112 and 130 on the systolic and 74 to 82 on the diastolic.
Okay, and then so that difference comes to...
Oh,
we'll
that's math.
Oh my gosh, you're going to make me do this.
That's your pulse pressure.
Yeah.
So let's say you're between 40 and 60. That's a good place to be. Now, as we get older, if it gets too low, the pump is failing. If it gets too high, the difference arteries are stiffening. All the things that control high blood pressure help your pulse pressure, the difference. So the DASH diet, which is dietary approaches to stop hypertension, sodium content of less than 1,500 milligrams per day. Guys,
We just looked at each
you're
other.
talking about eating pretzels at 4 a.m. You're not doing that. You're not drinking too much alcohol. You're staying active, getting enough sleep, and maintaining a healthy weight. So thankfully, the pulse pressure, even though some of it is just aging, some of it is in our control.
I'm going to start adding some of those things to my list.
I know.
I don't think I met any of those categories.
I know. I was
we'll
like,
work on it.
oh, and salt tastes so good.
But at least you'll know your numbers.
Yes.
Which means as you start to see that widen, if you're getting older, or you see that bottom number climbing, you're going to pay attention to top, bottom, and the difference.
DASH diet.
So get your calculator out on your phone. If you can't do math like I can, I'd be like doing that. Okay. All right. That's helpful. Thank you, Chris. Thank you. Now we're throwing to Kiss. Thank you, Dr. Kohli.